from section BS1C, and now we will be tackled about HIV. History of HIV. It was probably passed to humans when humans hunted these chimpanzees for meat and cane in the contact with their infected blood. Over decades, HIV slowly spread across Africa and later into other parts of the world. The virus has existed in the United States since at least the mid to late 1970s. Introduction of HIV. HIV is a virus that attacks the body immune system. If HIV is not treated, it can lead to AIDS, or acquired immunodeficiency syndrome. HIV is an infection that causes cells in the body. Also, HIV is a virus that attacks cells that help the body fight infection. I will show you a video about HIV and how it affects our body.
HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when your immune system is damaged and too weak to fight off ordinary infections. When foreign invaders, such as bacteria and viruses, get into your body, they can cause infections. These events activate your body's defenses. The white blood cells of your immune system are part of your body's defenses. One type of white blood cell, called helper T lymphocytes, or helper T cells, strengthen your immune system's response to infection in two ways. First, helper T cells release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply.
Where the HIV came from. HIV infection came from a type of chimpanzees in Central Africa. HIV may jump from chimpanzees to humans as far back as the late 1800s. The chimpanzee version of the virus is called simian immunodeficiency virus. This picture shows the Central Africa. Cause of HIV is caused by virus. It can spread through sexual contact, anal injection drug, sharing needles, and infected blood. These are the example or the cause of HIV, like sex, sharing needles, infected blood, anal, and etc. The effects of HIV: night sweats, muscle aches, fatigue, and sore throat. HIV destroys CD40 cells, white blood cells that play a large role in our body to fight diseases. What kind of HIV is? A virus or a bacteria? HIV is a virus that attacks the body immune system. What are the symptoms of HIV? First, fever, headache, swollen lymph glands, diarrhea, sore throat, and joint pain. How will you know if you have an HIV? The only way and the best way to know if you have an HIV is to get tested. How to prevent HIV? First, never sharing needles, using condoms right away every time you have sex, get tested for HIV, and do not inject drugs. Are you curious like me if the HIV is treatable? According to WHO or World Health Organization, there is no cure for HIV, but you can control it with HIV treatment. So let's know what the type of treatment for HIV. Or antiretroviral therapy, a combination of HIV medicine called HIV treatment regimen. Everyday art is recommended for everyone who has HIV. These are the benefits of antiretroviral therapy of HIV. So, did you enjoy watching the presentation of HIV? So now, let's proceed to the conclusion about the presentation or the discussion that I tackled, which is HIV. as a student nurse, I need to be careful by following the do's and don'ts to avoid HIV. I need to be wise to avoid this kind of virus. I will apply this lesson as a student nurse for avoiding the possible reason to get this kind of virus. I will take care of myself more, eat healthy foods, and proper hygiene. Thank you everyone for watching my presentation. I hope you learn about my discussion of HIV.